Our health, care and local government services have recognised the importance of working collaboratively. Integrated care systems, or ICSs, bring together NHS, local authority and other partners to take collective responsibility for improving the health of the population they serve. As of April 2021, there are 42 ICSs covering England. Our ICS will be established as a statutory organisation from April 2022, replacing clinical commissioning groups or CCGs. This legal status will give responsibility to meet 4 core principles: improve outcomes in health and healthcare, improve productivity and value for money, tackle health inequalities, help the NHS support wider social and economic development. To guide our work, we are committed to delivering on 10 key pledges. We've already begun to make progress, but we are planning to do much more. Pledge 1. We're working in 3 specific areas: improving the quality of maternity and neonatal services, preventing and controlling infections and continuing to develop key learnings. Our Acute Trust completed the first year of their Getting to Good improvement programme. What is next? Improving how we report on the quality of our services. Developing our approach to working with maternity and neonatal experts from other areas. Pledge 2. We've made a successful business case for £3 million of investment into our rapid response, case management and respiratory services. We've secured funding to open the first community diagnostic hub in Telford, which we plan to open by April 2022. What is next? Giving staff better tools to work with residents to prevent illnesses developing. Implement changes to our community end-of-life care and respiratory services. Pledge 3. We've reviewed the impact of COVID and how it impacted access to services. We've secured funding for alcohol care teams and launched a service looking at reducing smoking in pregnancy. What is next? We'll work on an inequalities action plan for our system. We're launching a winter campaign to promote vaccination uptake and getting physically and mentally healthy. Pledge 4. Our Children's Crisis Service is now a 24/7 service. We've co-produced a 3-year plan to improve our learning disability and autism service. What is next? We'll provide intensive support to children and young people with learning disabilities and autism. We're testing new multidisciplinary ways of working in our virtual community hubs. Pledge 5. Newly established Economic Regeneration Group has looked at economic activities delivered by both councils which are already benefiting communities. What is next? We'll develop a plan to attract investment, support the expansion of existing businesses and develop our infrastructure. We'll look at promoting skills training, apprenticeships and support for local businesses. Pledge 6. We have set up a climate change working group. We've appointed a board-level lead in each ICS organisation with accountability for meeting the government's net zero carbon emissions target. What is next? We'll develop a system-wide green plan to be submitted by April 2022. Pledge 7. We've created 4 new subcommittees and a system people committee. We've formalised arrangements to oversee plans for forming the statutory ICS. What is next? As we become a statutory ICS, we'll create an integrated care board and integrated care partnership board. We'll develop working arrangements so decisions about health and care services are taken closer to where people live. Pledge 8. We've established a memorandum of understanding with our voluntary community and social enterprise sector, outlining collaborative working. We've undertaken community engagements and listening exercises to help us develop new services. What is next? We'll establish a VCSE alliance that's plugged into the ICS board. We'll begin a large-scale public conversation to inform our transformation programmes and ICS strategy. Pledge 9. We've established a sustainability committee overseeing our financial recovery and improvement work. We've created transformation programmes focusing on 6 key areas to improve quality and reduce costs. What is next? We'll continue to develop our financial improvement strategy. We'll develop full implementation plans for each of the 6 key areas. Pledge 10. We've encouraged more emphasis on health and wellbeing for ICS staff. We've appointed a creative partner to deliver a recruitment campaign to attract talent into our system. What is next? We'll increase our nursing workforce through international recruitment. We'll work with local colleges to support people into health and care careers. We'll work to improve equality and inclusion, starting with diversity on our ICS board. To find out more about the progress of our NHS and our future plans, follow us on Twitter or visit our website and download our annual review report.